In a new sign of improving coronavirus conditions, California will ease its mask-wearing recommendations for the first time in 7 months. The state is largely rescinding its strong recommendation that everyone, regardless of vaccination status, mask up when in indoor public settings and businesses. That broad guidance had been in place since mid-February. Instead, California will recommend universal mask wearing only when a county's COVID-19 community level, which indicates rates of new coronavirus-positive hospitalizations, is high. Among the changes slated to take effect Friday is the end of state-ordered mandatory masking in jails and prisons, homeless shelters, and emergency and cooling centers located in counties with a low COVID-19 community level, as defined by the U.S. Centers for Disease Control and Prevention. Placement in that category, which was home to 35 of California's 58 counties as of last week, indicates the pandemic is not having a major impact on hospitals. The CDC updates its community-level assessments weekly, sorting counties into low, medium or high. Facilities can make their own decisions on mask use, but if an outbreak were to occur, masking would again be required by the state in settings like jails and prisons, shelters and cooling centers, even if the local COVID-19 community level is low, according to the state health order. A county's presence in a medium or high COVID-19 community level would result in a mask order in those settings. Individual counties also could keep more stringent rules. Masks will remain required in healthcare facilities and long-term and senior care settings under a state health order. And the state is requiring that businesses and venues, including K-12 schools, must allow any individual to wear a mask if they desire. The changes will give Californians the information they should consider when deciding when to wear a mask, including the rate of spread in the community and personal risk, Dr. Tomás Aragón, California's public health director and state health officer, said in a statement. They also reflect continued improvement in the Golden State's pandemic metrics. For the 7-day period that ended September 13th, the most recent available, California was averaging about 5,900 cases a day, roughly a fourth of the peak of this summer's wave. The number of coronavirus-positive hospitalizations statewide also is declining. At the summer peak on July 26, the census of hospitalized coronavirus-positive patients was 4,843. As of Monday, there were 2,313. Still, that figure is above the springtime low of 949. Even with the changes, when the COVID-19 community level is high, the California Department of Public Health will say mask wearing is recommended in indoor public settings for people at lower risk of severe illness and strongly recommended for people at higher risk.